governor's powers has been about the governor's superpowers. I mean, that's really all they talk about. Special powers. That's all we hear about is the authority. And let's go to Dr. Hoa Nguyen, who, is a member of the Governor's Physicians Advisory Group. He's been also, I would say a vocal critic of some of the things coming out of the administration. So, Doc, can you take us back to that clip that we just played? What was the sentiment with the doctors when the governor had said that? Were you there at that forum, and what was the reaction?
Yeah, good morning, guys. We really, I know the governor say that we really just not think much about it because, like I said, at that time, really, we don't expect it to be a pandemic emergency. So we just go back and prepare at the clinic in case it gets worse. But, we were concerned about what is our right as a clinic, as a private clinic, during this comment. But like I say, we didn't expect it to happen, and expecting to get worse for a short time there. So, it's for the governor. I mean, we have a discussion. We talk about it, and the Tier 2 and the CARE Act come up. We kind of say, well, we were willing to help to be the Tier 2s, and we have a lot of capacity to absorb patients. More than the single clinic. So I think that's why SDA and FHP and AMC kind of stand up in the care too.
Did you guys volunteer to be Tier 2 clinics, or were you directed as per the executive order?
No, it kind of not volunteer nor direct. I mean, at a certain time, she asked us to see if we were willing to help out, and at the same time, we are willing to help out. So it's kind of an effort for the two, the governor and the Tier 2 clinic to kind of come together as one and serve as a Tier 2. So she's not really, at the time people say take over, it's not really take over. It's the work is a combination of the two.
Mm-hmm. But part of that executive order, it made mention of a memorandum of agreement for reimbursements and things like that. Where is this memorandum, or MOU, or MOA, or emergency purchase agreements, or unsigned contract? Where are these documents?
On the CARE Act, it does mention that the Tier 2 will get reimbursed.
No. The Federal CARES Act doesn't say that. You're talking about the breakdown that BBMR provided, right?
Oh, no. We don't have any contract, not at this point. No MOU to get reimbursed. I think that the admit side of the house and the three clinics are working with the AG office. I know it's we go through the kind of proper channel. It's got to be blessed by the AG office in order for us to move forward. I think right now it's at the AG office. So, we really can't turn in or expect any reimbursement at all until it be go over to proper channel with the AG.
Right. So, Doc, I want to ask you, I mean, the subject of the government paying for services with no paperwork, I mean, that's the conversation right now. So how are you clinics feeling about your chances of getting paid? And, and then also I want to ask you to respond. Yesterday in the press conference, I asked the governor why you guys haven't been paid, why they use the superpowers to rush through payments for some things and not others. So how would you respond to the governor saying, hey, I can't pay these guys, we don't have an invoice?
I think that anything else in order for us right now, the number one thing is, guys, we're going to take care of patients. Like I say, it doesn't matter if we get paid at this time or pay later. We will continue to take care of patients. That's number one thing. You can't delay that one. And the rest of them, we just have to go through the proper channel. We cannot, give any invoice to get paid without knowing that what we give is legitimate or not. The AG has to say what we can give and what we cannot give. And that's to be fair for everybody, because this is not the time for anyone to kind of make profit of this thing. This is where we step up and make sure that our cost is covered. So we cannot just turn in any invoice because we need to get a guidance of what AG really wants. So we know what we need.
Right. I've seen a couple of some of the emails, the back and forth between the governor's legal team and some of the clinics, and it's clear that these tier 2 clinics have been financially impacted. You're providing government services because COVID hospital, GMH, because it is designated as the COVID hospital. You guys are handling the, what do you call it, the overflow,
Right.
and so you guys are doing that, and then on top of that, you're handling your own patients, and so you guys, it sounds like you guys are struggling.
Well, and also, Dr. Hoa, we
without compensation from the government.
Right, and we've also heard that a couple of clinics have had to cut back on staff. That one clinic has had to let go of doctors. So you're right, it is having an impact.
Yeah, it's in order to have COVID and see PUI or people that are sick in the clinic, you have to curtail quite a bit of your regular service. Just as a well child visit, we completed cut out well child visit for about a month. And even at this point, we only do half capacity because we just do in the morning for well child. In the afternoon, we can see the sick visit to come in. You can curtail your infusion service. Just those things, because you don't want to expose those risky patient to any type of illness. We move our Medicare population to a totally different clinic in order to isolate them and make sure they don't get exposed to sick visits. So there's a lot of things that the big clinic, the tier 2, curtail the service in order to continue to do this. We were thinking of step down a little bit on our triage until yesterday when the 11th case come up. So we have to go back and make sure we brief our staff again to be very cautious again because it's still out there. So, we do have to do that. But like I say, it's not a room that you can say, I pay for one room and you're done. It affects a lot of the service within the big clinic in order to provide the care. Again, we'll continue to do what we do. We don't turn anyone away, or when we see a patient that's sick, none of the tier 2 clinic collect anything. It's a free service at this point, and we continue to do that until things go away and let the admin side of the house take care of it. Right. I know in the end we get paid something, but at this point that's not a priority to stop our service to people who want.
Right. Yeah. Doc, I wanted to read because I just got a FOIA last night about, and I asked for any and all communications between the Governor's Legal Counsel, the former Chief of Staff Tony Babauta, just a whole bunch of people, and the Tier 2 clinics. And I wanted to just read a little piece of an email from the Governor's Legal Counsel, which after watching the hearing last night and then reading this, so ironic, because they spent the whole hearing talking about how what they did, what little they did say about what they did because they hid behind attorney-client privilege, but they said that it was all legal, it was all well and fine. But in one of the emails to the Tier 2 clinics here, the Governor's Legal Counsel writes, "We have not received any indication that any medical facilities, supplies, or providers have been formally directed to act as government entities. This would have been in the form of a contract for procurement purposes. And as you know, procurement law does not allow for payment of services prior to the execution of an agreement." I just thought that was so ironic because that's exactly what we did for the hotels when the Governor's Legal Counsel was leading the effort. And that's why I asked that question, why was it okay then, but not now?
Yeah, I'm not a lawyer, I can't say that. I know that the CARE Act basically spell out that you to form like the hospital, the Commission of Hospital, GMH, GRMC, the Tier 2 clinic and Tier 1 clinic. So it's pretty well defined what your responsibility is to deal with this pandemic emergency. So you are under the umbrella of Stone Forum on this CARE Act. declaration that the government put out. So yeah, I mean, at this point, again, it's hard for us to do anything without a formal contract. And so far, no. Like I say, I understand that from our counseling that the process to go through the procurement or whatever they call it, it takes a long time. So we just sit back and just wait.
7 days.
You know, yeah. I mean, that's the part where they either fast track you through the Procurement Act, or we're just going to go through the normal channel. And I say eventually, at the end, you will get reimbursed something if we do.
Something.
But again, it's something But at this point, it's not going to be the stop thing that we're going to change our practice. No, everyone walking the front door will be seen. There's no appointment need for anyone that gets sick, because our main goal here is just like the 11 case that public health did. This very good job is identify, contain them, and that's just our job, is make sure that when people walk in the front door, they get sick. If we identify they have COVID, we'll contact, isolate them to make sure that Guam is safe. We continue to do
But
that.
I don't think you guys have a choice to back away from being a tier 2 clinic. I think that was kind of solidified in this executive order that you guys are directed to be tier 2 clinics.
Exactly. In order for us to get out of this thing, they have to lift the pandemic emergency.
Right, and that is tentatively June 5th? Right, 30 days from...
Yes, Yes.
Yeah, June 5th.
If it's lifted, then the CARE Act will be dropped. But at this point, legally, it's very hard for us to back out of this thing.
Right. Doc, so have you guys gotten paid anything?
We get paid zero.
Right. And actually, this was a letter from Speaker Barnes on May 4th. It was actually to Dr. Mike Cruz with the Governor's Physicians Advisory Group. You're on the Physicians Advisory Group.
Well, yeah,
right?
I'm the chair, yes.
You're the chair?
Yes.
Okay, and as the chair, has this even been discussed in any of your meetings?
Well, I purposely never discussed in the meeting because I think it's a conflict of interest for me as one of the partners in the Tier 2 to discuss this. So I don't think it's right for me to discuss it. So we basically doing the advisory group mainly to talk about what's best to approach this pandemic and how to advise the governor in going forward in taking care of this. But we never discuss about any type of payment.
Yeah.
To me, it's a conflict of interest.
Good point, Doc. So when you talk about advising the governor with these 11 positives that we got, but we only had 0 last night because they're not going to test over there anymore because they're positives. I'm just kidding. So what's your advice going to be to the governor moving forward now that we have this cluster or spike, surge in cases?
We know there's still case out there that we have not identified. No, this 11 case is the work of public health and the tracing team. And to us, as advisory board, it's very good that we feel confident that the tracking and the tracing team are doing their job. So identify a source, they track it, they do all the history, and they come to the right place. And that's what gives us confidence to go from peak hole 1 to peak hole 2. As long as they have the ability to do that, the rest of the public should be very confident. I know that they communicate that with the mayor of Eagle and let them know what's going on. So it's very open to them, so that way the community up there can know and the mayor can do his job. But this is where public health tracing on a positive case really work, and they did a wonderful job, and we advisory board feel very confident of what they did at this point. So it's good that it's a cluster, it's a compound that they identify, so now that they can isolate those compound and people will not go out and spread it. Again, the question is that a previous infection, or is that an old infection that pick up this point? But they're going to go back and do a lot more history on these people and try to trace some more to see if they come in contact with someone else. So it's a working process, but we know that it's working. So that's again, whatever they do is working at this point. and that's what keeps most of the days to zero. So we actually do very good in Guam.
Could you clarify something? I know that when we last talked, you had mentioned that the Physicians Advisory Group was going to put out the recommendation to the governor to allow for returning residents of Guam that have either came from the U.S. mainland or from the CNMI to be allowed to do home isolation or home quarantine. So they wouldn't have to do the 14-day quarantine at local hotels. I think that was 2 weeks ago. Where are we with that? Is this a clear response of no?
No. It's we wouldn't work with public health, and we come to very close to the home base on remodify the guideline and have a volunteer quarantine for our return resident coming back to Guam.
Yes.
So it's supposed to be volunteer. The patient or the passenger can have a choice. If they have a family that they feel uncomfortable going home because they're so packed in the household goods, they have a choice of staying in the government quarantine facility if they choose. But they also have a choice to go home. So it's a volunteer quarantine at home, not in the hotel. And we come very close to it. I mean, give another week or so, it should be finalized and do this thing. And the governor is very specific. She wanted it done like ASAP. So, public health along with the advisory board work together and try to finalize this thing as soon as possible. And to clarify who's paying for it. It's like if you are not from Guam, yes, you will be responsible for the hotel, and Guam not paying for it. So it's only for our residents that the government should pay for it. But again, it's a volunteer 14 days quarantine. The people want to get back from our finance have to stay at home. And you can go shopping, you can go do stuff because you still quarantine at home, just like in a hotel. But it's a much more friendlier environment for the people to come back, especially the college kids.
Okay, so you presented that, the Physicians Advisory Group presented that to the governor and public health over a week ago.
Yeah, it's take time to kind of...
Because I want to say you said we got to stop wasting money here.
Yeah, I mean, it saves us money a whole lot. Right now, it's a lot of people in a hotel, which is, it costs a lot. But if you can quarantine at home and have a monitoring system to track them, it saves everyone. And psychologically, too, it's good for the kids to come home and our family come home without having to worry about staying in a hotel. So it's a plus for everyone. At first, she had to do that. We don't have the power to shut down the airport and say no flights from the PI, from the Philippines, which is the main source of coming in. So we don't have the power to do that. So the only way you can do that is mandatory quarantine them in a hotel for 14 days. You do that, nobody come back, because they're afraid to be in a hotel.
Right.
So she had to exercise that right in order to shut down the flight. Because only the federal can prevent the flight from coming in.
Yeah, I think we've been through that.
Yeah, so now that we passed that stage, we have to come back in and we look and say, hey, what we did in the first few weeks, now we got to change it. So we have to change it. Again, we passed multiple bases already, so we are moving forward quite well. So soon, guys, we will be able to let our people come home and quarantine at home.
All right, Doc. Hey, I just want to let you know we got a comment here from BT Wen on our Facebook. It says, Dr. Hoa is my daddy. I'm so proud of him.
Yeah, that's my girl.
Well, she's
Daddy's
proud of you,
girl.
Doc. Okay.
Thank you, guys.
All right.
Thank you for everyone to put out the news there. But again, please, on the public, we still need to be very cautious. And again, I want to mention masks, social distancing at 6 feet, and hand washing. Really, guys, we need to continue to put that zero on the book there, so that way we can open our economy and everything, be back to some new normalcy. Okay.
Yes.
Thank you, Doc.
Thank you, guys.
Thank
Have
you.
a good morning.
Wash
You
your hands.
too.
Okay.
Okay, bye.
Bye-bye.
Okay, Dr. Hoa Nguyen of the Governor's Physicians Advisory